Hello, and a really warm welcome to the final session of Psychological Professions Week 2023. My name's Adrian Whittington. I'm National Clinical Lead for Psychological Professions at NHS England. And today, this afternoon, we're focused on the future and the future growth of the psychological professions, particularly with a focus around the NHS Long Term Workforce Plan, what it means for us and what it means for the public. So really excited to be kicking this session off today and to be joined by this amazing cast of other speakers and contributors. And we really hope that you'll be able to contribute as well through asking questions in the Q&A button, which you'll find at the top of your screen, and also through some sort of Mentimeter questions that we have for you. So there's a real opportunity to have some dialogue here. So I'm going to just take you through what we've got planned for this afternoon. So we're going to be sort of introducing the session and some of our speakers, and then I'll be leading you through some thoughts about what we should do with this NHS Long Term Workforce Plan that was published in June and what it means for us. But a really key question is, what does this mean for the public? So what? And so it's a delight to be joined by experts by experience, Joe, Sharon and Paul, who are going to help us think about that. And then an opportunity for panel discussion, questions and answers towards the end of the session. And we're going to close the session with some reflections on what a week it's been, and just some of the things that we've learned across the week from hearing from so many different speakers in different sessions through the week. Great. So before we go any further, I'm just going to invite you to find this Mentimeter set of questions. So you can do that by typing menti.com into a browser on your phone or on your computer. And you'll see there are 3 questions within this Mentimeter. So these are designed to just give us a bit of a sort of chance to engage with you, for you to have a think about where are you with this NHS Long Term Workforce Plan? What does it mean from the position you're in, whatever that is? And so if you do, feel free to log into that now and pick up and think about and answer those questions as we go through the session, and then later on we'll see how you've got on and pull the results up. Great. So I just wanted to, before we sort of go further, introduce other members of the panel. And so we have our experts by experience panel who will be sort of speaking and discussing the implications of the plan a bit later. So if I could just ask perhaps each of you to introduce yourselves briefly. I'll pass to Joe first, please.
Hello everybody, my name's Joe Keeney. I live in Manchester and I'm an expert by experience. In the last 12 months I've had 2 separate operations for physical conditions, and what I want to reflect on today is how the psychological aspects of that were very important throughout that care. And so that's me today, and I'll be discussing that later. Thank you.
Thanks very much, Joe. And over to Sharon next.
Thank you, Adrian. My name's Sharon Galliford. I'm also expert by experience. I'm a carer by background. I work with the PPN South East mainly, and I also chair and coordinate the Service User and Carer Advisory Group at the University of Surrey. Thank you.
Thanks, Sharon. And finally, Paul.
Hello everybody, my name's Paul Edwards. I'm an ex-detective who had to retire with job-induced PTSD from the police in 2016, and since then I started volunteering with my local service, and now I'm proud to work with Talking Therapies National Team, NHS England, the PPN through the Midlands, and also the Lived Experience Advisor Group, the BABCP, and also a number of universities. So I'm very, very fortunate. I have a passion for the patient voice and co-production, and particularly I also have a passion for parity of esteem between physical and mental health to try and break that stigma. Lovely to speak with you all.
Well, thank you all so much for bringing your wealth of expertise, both through your personal experience, but also through a whole range of different roles that you've taken up across the system. We look forward to hearing more from you later. So it's a great pleasure now to introduce Debbie Riley. Debbie's the Senior Responsible Officer for Mental Health, Workforce Training and Education at NHS England. And Debbie's been a real champion for what we've been trying to do in the psychological professions. So I'm delighted Debbie can join us. And Debbie, over to you for your opening remarks.
Thanks, Adrian. Good afternoon, everyone, and I am delighted to be here today. I feel very honoured and privileged to hold the responsible officer role for the mental health programme. And we all know, I'm sure, that you've all read cover to cover the pages of the NHS Long Term Workforce Plan. It is really a groundbreaking document setting out the strategic direction for the next 14 to 15 years. Psychological professions will be a key in playing an ever greater part. You can see that throughout the document. For the NHS as a whole, and mental health and physical health. So it's a really vital, important, because we know we cannot continue to carry on doing things the way that we've done things. We need to work in a much smarter, integrated way that really embeds psychological health in all of the healthcare. The plan really sets out a significant ambition for growth. And I know that Adrian will be using today as a call for action, because whilst the long-term plan is a document, you need to be able to bring it to life in order for it to be effective. And we cannot turn it into reality for that to happen unless everyone plays their part. NHS England, of course, the Workforce Training and Education Directorate team is completely committed and will play its part in commissioning education. But to grow at the right pace and in the right way, we really need your help to put all of the right steps in place for services and education providers to really make this happen on the ground. I just wanted to say a big thank you from me for all the work that Adrian and the team, or the Psychological Professions Network, all the experts by experience, and to all you professionals for really driving this agenda and for supporting us to make this ambition a reality. I wasn't going to say anything more than that, Adrian. I think it's a really exciting time, but I'm very happy to take questions. Back over to you.
Thanks so much, Debbie. And I know that you are going to need to head off in a moment, so there is an opportunity for anyone who would like to ask Debbie any questions specifically to do so. We'll just give you a couple of minutes to type anything into the Q&A that you particularly wanted to ask Debbie about. But perhaps while we're waiting for you to do that, if you do have any thoughts, perhaps I could ask you, Debbie. I mean, of course, I agree it's an exciting opportunity, what we have in the long-term workforce plan, but I'm sure the experience of many practitioners in services is that there are also real challenges at the moment in sort of delivering services, managing demand, and trying to sort of expand at the same time. And I wondered if you had any thoughts about how a practitioner in services might sort of go about bringing those things together, bringing the sort of the opportunity of the long-term workforce plan together with, you know, some of the challenges in their experience in services.
I know how particularly challenging it is, certainly on services on the ground. But for me, I always will encourage you to strive for the art of the possible. We know that we have to balance the book. So whilst we are constantly talking around significant growth in all the scenario plannings, we have to work in a smarter way. And the only way that this is going to work is actually on the ground changing practice. So what I would always say is always aim for the art of the possible. Don't let barriers get in your way, because what always drives forward is actually where it makes sense. So I'd encourage anybody to build the relationships, build the collaborative ways of working. I think this is a fantastic time now to really drive this agenda forward.
Thank you very much. And I do see we've had one question come in for you, which is this the first time we've had such a long-term, i.e. 15-year plan? Did you want to make any comment on that?
It's a good question. Thank you for being kind to me. It is the first time there has ever been such a document. It's groundbreaking, but again, it is a document. We've had something around Framework 15, so we've had a more strategic framework, but this is a document that clearly outlines the growth that's needed in order to meet service demand. Again, I would say it needs everyone to play their part to make it a reality. Otherwise, it will just be another document. So for me, it's about really engaging with your system partners to really drive this agenda.
Brilliant. Thank you very much. So there's one more question that we'll take, and I think this reflects the fact that in fact we have two sort of policy documents with very similar names. One was the long-term plan and the other is the long-term workforce plan. But the question is, what gaps are you aware of that may have surfaced since the long-term plan was published? And I wonder if you've got any thoughts on that, Debbie.
I think, if I'm honest with you, it's constantly evolving. And if you have said to me, have we ever found a solution that's never had any gaps? I would say not in my lifetime. However, it's about how we work together. So I think the long-term plan will have a refresh. There is also a guarantee that the long-term workforce plan will have an annual refresh. And again, that's the first time that this is going to happen. So I think it'll be down to, the systems, the service provision, the professions to really drive this agenda. But if you ever think you're going to have one perfect document that has everything to perfection, I don't think that's going to happen. But I do believe that there is passion and commitment on the ground to really make this happen.
Brilliant, thank you. So I think we've probably got time for both of the other questions that have come in, and they're not all as kind to you perhaps as the first one. They sort of are interesting questions that really require us to challenge ourselves, I think. So the first of these is, how can we ensure our ICBs, that's integrated care boards for those who don't know, understand the importance of prioritising mental health and aren't overcome by pressures in the whole system?
That's a good question. I can't see who's asked it, but it's a really good question. I think, again, there are always going to be priorities. There are always going to be balance around those priorities. And I think it will come down very much to the professions to highlight the concerns and the risks. I have never been in a space where actually the service provision and the mental health programme has had such a priority where funds are certainly ring-fenced. So I think it's on the forefront of every system to drive this agenda and make sure that for the population that the relatively regions and systems provide, that they really drive this agenda going forward.
Great, thanks very much, Debbie. And that really leads us quite nicely to the final question for you, which is there a plan for senior representation of psychological professionals at trust board level, as this may be an enabler for some of those sort of delivery challenges that we've described?
I think that's a joint one for me and you, really, Adrian, because I think if I've seen change and seen shift around psychological professions, it's certainly been in the last 2 years. So yes, I do think there is a space for it. I do think, again, it will be round to the professionals to really drive that. I'm going to hand that one back to you, I think. Yeah, that's my view of the world. I have always been completely very supportive in the last couple of years in this space, and we will continue that.
That's a perfectly fair hand back. Thank you, Debbie. And I would just say I would support where trusts are able to have psychological professionals at trust board level. I think it does make an enormous difference where that has happened. It's all too rare. and people may be interested in the Psychological Professions Network paper that promotes psychological professions leadership at trust board level and makes that case. So do have a look on the website amongst our resources for that. You know, I think leadership is going to be so important, clinical leadership and professional leadership, and we really need to articulate that and drive it forward, including to board level. Great. Well, Debbie, I just want to say thank you very much for joining us. It's been sort of really valuable having your launch for the session, and to sort of see how this psychological professions work is embedded in the wider work around our workforce. And I know you need to head off now, but thank you very much also for taking those questions.
Thank you. Have a good afternoon. Thanks, everyone.
Thank you. So I'm now going to just highlight, I suppose, some of the sort of content and implications as I see it in the NHS Long Term Workforce Plan. I guess we've all sort of got very full inboxes, and a sort of very dry policy document landing there may trigger certain reactions. We go to the next slide. This is the reaction that I would suggest we don't have in relation to the NHS Long Term Workforce Plan, because I think it does contain some really important implications for the psychological professions and for the public. And I think the onus is really on us to digest it and make use of it. So if we go back to the kind of mission that we're on, if you like, and people may remember, you may have been involved back in 2019, 2020, when we launched the Psychological Professions into Action programme, which was a kind of co-constructed research programme looking at, you know, what could be our collective commitments around maximising the impact of the psychological professions for the public. So we ran a campaign that had, you know, a number of remote login opportunities. It also had some physical events just before things locked down for COVID. And through that process, we generated actually from a whole range of different people, psychological professionals, other professionals in the NHS, members of the public, experts by experience who'd used services, generated thousands of ideas about how the psychological professions could have maximum impact. And the end result of that process, once we'd undertaken some careful thematic analysis, was a vision for the psychological professions, something we could all sign up to across the different occupational groups in the psychological professions, to transform lives and communities by extending and embedding psychological knowledge and practice across the whole of health and care. And within that, a number of sort of commitment areas around putting people first, helping our communities to thrive, making all health and care psychological, etc. You can see them there represented as planets. So if this is our mission, what does the NHS Long Term Workforce Plan mean for us? Well, sometimes I sort of summarise and use a bit of a shorthand for this vision, this mission. We go to the next slide, which is that we need a more psychological NHS. And this doesn't capture the whole of the vision, but I think it's significantly overlapping with us. And we need a more psychological NHS because it's very clearly what the public are asking for. So where it's an option, people would choose a psychological way of working, a psychological therapy or a psychological intervention over medication for mental health difficulties by a ratio of about 3 to 1. There's great evidence for effectiveness of psychological ways of working across a whole range of different pathways, different types of issues, and different types of intervention. And implementing these ways of working, we know, can drive cost efficiencies in the system. So this isn't a sort of nice to have, icing on the cake component of services, a more psychological way of working. It's absolutely core to answering some of the challenges that we're currently facing in the NHS. And yet, most who could benefit from this psychological way of working currently can't access it. And this absolutely needs to change. But I think, as we alluded to earlier, if we go to the next slide, let's face it, this is a very challenging time for NHS commissioned services. It's challenging for those who work in services. It's also very challenging for those who use services. And yet, even at this challenging time, is there a time of opportunity for us? Is it possible to find opportunities, perhaps particularly from this latest long-term workforce plan? Well, I believe that it is. And the reason for that is that I think we're in a policy context now that is really stronger in pushing for a more psychological approach than we've ever had before. So if we go to the next slide, this highlights some of the key policy documents and commitments that are helping to drive in this direction. So the NHS Long Term Plan, which ran from 2019, is a really sort of key commitment to expanding psychological ways of working across a whole range of different pathways. It did focus on particular pathways. And so of particular relevance to psychological ways of working were increases in therapies across anxiety and depression, community mental health, children and young people's mental health, and perinatal mental health. And the commitments within that long-term plan were pulled out further in relation to mental health in the mental health implementation plan, which was built on the back of it. And this plan set out specific workforce growth numbers for the psychological professions as well as other occupations. And it was focused on mental health, so it didn't pick up everything that psychological professionals do. Clearly, we have a very significant role in physical health services too. But it was very significant for us, and modelled numbers that were really quite sort of ambitious and important in sort of specifying what would be needed in expanding our workforce to deliver on those service commitments in the long-term plan. But I think we've all probably experienced that at times the psychological professions aspect of workforce growth hasn't always been well understood. So we deliberately pulled out the implications for the psychological professions into a profession-specific plan. So this was the Psychological Professions Workforce Plan for England that we published in 2021. And this highlighted really the sort of scale of the growth and some of the enabling work streams that would be needed to help us move this forward effectively. And the headline was that at that time, the sort of mental health implementation plan signalled a need for a growth by 60% in the psychological professions if it was to be delivered. And the plan also set out a number of key enablers that would be needing to be tackled across all different parts of the system, so nationally, but also regionally and within systems, within integrated care systems and boards, and locally by provider organisations and higher education institutes. So no one organisation holding all of the levers for change, but absolutely needing collaboration across all those different parts of the system. And then in June this year, we had the publication of the NHS Long Term Workforce Plan. And this is what we'll focus more on during this session. Again, it specifies some very significant numbers for us to support growth and support delivery. And finally, I've highlighted at the bottom of the page there the major conditions strategy as well. This is currently at a sort of stage of publication that's called the Case for Change. There will be a further sort of strategy document coming through soon. And this highlights across 6 major conditions, from cardiovascular disease to musculoskeletal conditions, to dementia, to mental health, that these conditions account for a really significant proportion of mortality and morbidity, and push for a sort of shift in the dynamic towards a more preventative, early interventive, and integrated approach to physical and mental health care. All of those things requiring a greater input and growth in psychological practice. So it's another significant document. When you put all of these things together and just look at what's been modelled in terms of workforce growth that's sort of specifically named as psychological professions growth, then this looks like a 150% growth from 2019 to the end of the long-term workforce plan period, which is 2037. So that's a massive 150% growth over that period. So let's take a bit more of a look at what's in the NHS long-term workforce plan. So its purpose is to set a strategic direction for the long term. And this is, as I think we've alluded to, unique and new. It's not been done before. There were some sort of serious uncertainties at various points about whether a plan would be published or not. And I think that's partly because, of course, it's very difficult for any government to make a commitment for 15 years. But this is a document that sets a strategic direction for 14 or 15 years in terms of workforce growth. And that's absolutely needed because workforce planning actually requires a 15-year or so planning cycle to be effective. It takes a long time to train people. The plan, though, also commits to some concrete actions that are more immediate, that can be taken locally, regionally and nationally. And some of those concrete actions are set out. So it really has three kind of main threads or themes within it. Train is about more education and training than ever before in the NHS. And let's face it, you know, a key target here is about more doctors and nurses, and that's absolutely crucial because we know that there are real challenges in both of those workforces. But it absolutely focuses on the broader workforce as well, including the psychological professions. It also highlights a greater focus over time and needing to focus more and more on apprenticeships and alternative routes to training. Retain is about helping to keep people, good people, in the system and making the NHS a great place to work. And that, of course, is an enormous sort of process and challenge in itself, but includes better support, more effective career structures, greater flexibility in working conditions, and the right culture and leadership. So these are also huge agendas and ones, in fact, that the psychological professions can make a really significant contribution to. And reform is about working in new ways, so using flexible skills and new technology. So in our space, I suppose, this might include new roles. We have, of course, a number of new roles in the psychological professions, and might include thinking about how can technology enhance learning, support our growth, how can technology enabled delivery support a more psychological way of working in services. Okay, if we go to the next slide. I'm going to highlight now key messages for mental health as a whole. So these are clearly beyond psychological professions, but across the whole of mental health. And of course, psychological professionals aren't only working in mental health, but such a large proportion are that I think just knowing a bit more about key aspects of mental health is important. So significantly, the plan commits to education and training plans being formulated over a 3-year period. Now, this may not sound that radical, but actually, for those of us who have been really sort of working with 1-year funding envelopes, year on year, a 3-year planning period for funded education and training is going to be a really sort of major breakthrough and advantage. It allows that sort of slightly longer term planning and means there's less uncertainty for education providers, placement providers and others. The plan does commit to further iterations being developed every 2 years, and so we've got opportunities to shape and flex the plan as it goes forward. And that's really important because we all know that the context shifts and changes and new opportunities arise. So in mental health, the ambition in the plan is to increase across all of the different aspects of mental health services. So that's primary care, community care, specific mental health services by 73%. So that makes mental health the largest growing pathway in the NHS, with a growth rate in its workforce of 4.4% per year across the whole period of the plan. So forgive the detail here, but I think it's important to just recognise that point. This makes mental health the fastest growing pathway in the NHS. So some real ambition here. And of course, we know that comes with its challenges. So some of those challenges are around placement capacity, supervision capacity, etc. And the plan builds in the sort of absolute need to attend to that. And for any of you who were able to join the Southwest PPN session this morning, I think it was a great example of how regionally some of those challenges can be addressed and risen to through a coordinated approach, problem-solving approach. Great. If we go to the next slide, I'm going to now highlight implications for the psychological professions more broadly. And this is across mental health and other pathways. So the plan includes a workforce model that highlights the anticipated workforce demand. This means how many more posts do we think we will need by 2037? And for the psychological professions, the plan highlights the need for growth by 24 to 26,000 posts. So deep intake of breath. That is a huge growth. It's roughly 100% growth on where we are now. So we're really looking forward to getting the results back from the recent first ever psychological professions workforce census that took place in the summer. But when we look at the initial results from that census and compare those across the results that are drawn from staff electronic records, it looks like we have about 27 or 28,000 psychological professionals currently working in NHS commissioned health services. Another 24 to 26,000 needed across this long-term workforce plan period. So it's about 100% growth, hence the title of this session. Plan highlights that this isn't all about 1 or 2 or 3 workforce groups or occupations. It's about the expansion across a whole range of different roles. And this is really important because we've seen great diversification of the roles in the psychological professions over recent years. So it specifically names the expansion of psychologists, of psychological therapists and psychological practitioners. And it names the fact that this will need to be across pathways. So it's not just mental health. It's across mental and physical health pathways. The plan highlights that we will need to continue doing what we've done over the past several years to train more psychological therapists and psychological practitioners. So at the moment, we're training about 5,000 psychological therapists and psychological practitioners each year. And the plan commits to continuing that for another 3 years. Of course, this is where, when you think, well, hang on, this is a 15-year plan, what's going to happen after 3 years? This is where we need our next iteration in 2 years' time to be more comprehensive. And the plan also has an education model within it that highlights continued sort of expanded rates of training for clinical psychology and for child and adolescent psychotherapy. But actually, the overall education model doesn't mention the other groups. So again, in a year and a half's time, I would be wanting us to be developing a plan that has a more comprehensive education model that incorporates all of our different groups. And very helpfully, we were very pleased that the plan includes a commitment to review and potentially increase what it needed, both from an ambition side and an education supply side. Because it recognises specifically names the psychological professions as an area that may need to grow even faster than this trajectory suggests. The plan makes a really strong commitment to grow apprenticeships as a higher proportion of our sort of training delivery. And this is really important for us because we've got some great apprenticeship developments in the psychological professions. So we have the Clinical Associate in Psychology apprenticeship, which is proving to be popular across many regions, which is making a big impact. I know there have been great community practice events this week that have highlighted this. We also have a psychological wellbeing practitioner apprenticeship that's been successful as a sort of adjunct to other forms of commissioning that training for NHS talking therapies. We have a family and systemic psychotherapist apprenticeship that's in development and will be going out to public consultation on its apprenticeship standard shortly. and we have the emergence of a potential CBT therapist apprenticeship. So this is a great sort of area for us to be aligning to as we develop our apprenticeships and grow them. And the plan has a really strong emphasis on retention. So I think this is vital, that we don't get too aligned to only achieving growth by training more people. We need to also absolutely create the right conditions that people will want to stay and make a career in NHS commissioned healthcare in the psychological professions. So if we go on to the next slide, of course, we have some great sort of raw materials for taking all of this forward. We have a whole range of different occupations within the psychological professions, and for those of you less familiar with this table sets them all out. There are 21 in this taxonomy, 21 different occupations with distinct characteristics and capabilities. They're all really important in driving this all forward, and we're going to need more of all of them. And you'll see that they essentially split down into psychologists with some linked associate and assistant roles, psychological therapists, and psychological practitioners. And there's a number of different sort of named occupations within each, as well as recognizing there are other groups also which work in psychological ways and make a really important contribution. Okay, so if we move on to the next slide, how are we getting on with all of this then? Well, I suppose if we map out the trajectory of what our growth has looked like in the dark blue there, and would need to look like in the slightly lighter blue, this is what that trajectory looks like. So going back to 2007, this was the year before what was then known as IAPT, Improving Access to Psychological Therapy Services, now called NHS Talking Therapies, year before it was born. So we had about 8,000 psychological professionals then, and about 90% of them I estimate would have been clinical psychologists. If we fast forward to today, as I say, I think we've got about 28,000 psychological professionals, and of them about under 25% are clinical psychologists. So we're in a massively diversified field of psychological professionals that has hugely grown already. But fast forward and build in the sort of long-term workforce plan growth, and in the next 10 years, we need to sort of get to getting on for 50,000 psychological professionals. So the growth rate continues at pace. So we can, if we click, we can dig more into what's actually happened in this bit of the graph. We've got some really kind of clear data for this bit of the graph from 2015 up to the current day. And if we go to the next slide, you'll see that this is what our growth actually looks like. So this data is drawn from the electronic staff record. We're really aware not every psychological professional is on the electronic staff record. Not everybody is coded correctly. But this shows us that by March of this year, that this record suggested 28,000 or so, 29,000 according to this, psychological professionals in the system. And that represents a 51% growth on where we were in March 2019. So over 4 years, we've grown by 51%. And it's thanks to the hard work, dedication, commitment of a huge number of people that this has happened. So, you know, this is a real demonstration, I think, that where you do have policy that's pushing in a certain direction, and you have people across all different parts of the system willing to work with that and make it happen, that real change can happen. And of course, that 51% growth means a vastly increased number of people receiving psychologically informed or psychological services. And it's important to note this isn't universal. So actually the psychological professions are unusual here. We're growing much faster than other groups. When you look at the overall NHS staff growth over the same period, it was 16%. So the service is growing, and it needs to grow because the demands and needs are growing as well in the population. But the psychological service through psychological professions growth is much, much faster than that. So how are we getting there? Well, if we go to the next slide, you'll see that one component of this is growth in education and training. And when we look at the sort of total number of commissioned training places over the period since 2018, they have grown really significantly. They've more than doubled. And this is across a whole range of different roles. But I think this diagram really demonstrates just that when you put all of those together, this is a really massive growth in the amount of education and training commissioned. And this spans our apprenticeships as well as our core nationally commissioned training. Okay, if we go to the next slide, it is across a wide range of roles that this growth is happening across those 21 roles. And I'm bringing this slide up because today I'm able to sort of give you news of the relaunch of the PPN career map, which is a great resource for anyone who's interested in a career in the psychological professions, either starting your career there or changing your career to move into the psychological professions. We need you, and there's a great career to be had. And the career map is great because it's interactive, so it allows you to navigate it from a number of different positions, whether you're a graduate or you're not a graduate, whether you're a psychology graduate, whether you're another mental health professional already, and gives you sort of a route through that shows you what your options might be. Because this is complex territory with all of these different roles, and each role also has a sort of descriptor that with details of what the training involves, what the entry requirements are, etc., what some of the prospects are within that role for further development. So do have a look at that, and in parallel to this there is also a great resource called NHS Health Careers that you can access, which has details of all of these different psychological professions roles. So if you're not familiar with all of this territory already, please do dig into these, but also they're there for you to use to point others to. Okay, so if we go to the next slide, I want to illustrate that the real diversity in how training is being expanded. So these are some of the trainee commissions from last year, and you'll see here this really does spread very sort of wide across a whole range of different roles. So the largest group of training commissions being for psychological wellbeing practitioners, for NHS talking therapies, high intensity CBT therapists, clinical psychologists, but then a whole range of other roles there as well. And, you know, all of these making a really important contribution, but you'll get a sense there of sort of how that spread is unfolding. But there are some real challenges, and it was great actually to attend the Southwest event this morning and hear how some of those challenges are being tackled collectively and in collaboration, because I think it will require that collaboration and collective effort to make all of this happen. We've got a complex set of roles, we've got a lot of things growing at the same time, we've got supervision capacity issues that need to be attended to and managed, and you know, this really is an exercise in sort of finding solutions to quite complex challenges, and some of those challenges are significant. So if we go to the next slide, I just want to set out three of them. First of these is that in some areas of workforce we are starting from a very low baseline in terms of our psychological professions workforce. So we don't have anywhere near as many psychological professionals as we need in physical health services or in some of the pathways that weren't such a strong focus in long-term plan, pathways such as older adults or learning disabilities. And there's an absolute need to sort of grow from this very low baseline, which means we may need to sort of adapt our sort of growth trajectory to build even more or even faster. Another example of this is in adult community mental health services, where we have been growing psychological practice, but when you look at the specific psychological therapies that are recommended by NICE, this has sort of recently been sort of audited, and we found that actually it's less than 2% of those who are on the caseload of adult community mental health services, so this is outside of NHS talking therapies, less than 2% on the community mental health caseload have received psychological therapy in the past year. This clearly isn't where we want to be, where many of the sort of issues and conditions people are grappling with who are using those services do have recommended therapies that are available, but they're not currently available in the service. So low baseline, need to grow faster and further. The second challenge is large demand growth, and the example I'll give of this is in children and young people's mental health, where again we've seen the sort of workforce grow really significantly, and a workforce census from children and young people's mental health shows this very clearly. But we also know that demand has grown more. So even where we're growing rapidly and significantly, we may need to upscale our ambition in order to meet demand and work in different ways, working more upstream in prevention, early intervention. And the third challenge I wanted to highlight is expansion running behind the ambition. And this, is not surprising, but we can see it very clearly. So if we look at NHS talking therapies as an example of this, when you model the sort of workforce growth that would be required to achieve some of the goals and metrics that are targets within NHS talking therapies, whilst we've grown really significantly the NHS talking therapies workforce over the past 5 years, we haven't grown to the place where we have modelled that we would need to be providing access and recovery at the expected rates. So it's not surprising that sometimes there's a high level of stress in some services where we haven't been able to grow at that expected rate. So again, there might need to be sort of a real focus on these areas. How do we push and expand at the pace required to catch up on that ambition? And if we go to the next slide, another sort of really vital challenge for us is to take the right action on equality, diversity and inclusion as we grow. So we don't want to just grow the same. We want to grow in a way that is fully inclusive, that makes the psychological professions a great place to work, whatever your background, and that provides true equity of opportunity. If you were able to attend a sort of session that was specifically focused on this on Monday of this week, you'll know that there's some great work going on in this area and some signs of hope as well. But we need to do more. We need to focus across the protected characteristics. So do have a look at the Monday session if you haven't had a chance to. Okay, so what else do we need to do to make all of this happen? I'm just going to briefly highlight some actions at different levels of the system, different parts of the system. So nationally, we know we've got this opportunity in about 18 months' time for the next iteration of the long-term workforce plan, the next version, and we think we need a psychological professions workforce plan that can help to feed into that reviews and updates the education model so that it's more comprehensive, and that contains sort of enablement around career pathways and other developments to support this extraordinary level of growth. Regionally, we know that there'll need to be loads of support for making all of this happen. And this is challenging at the moment when we have an NHS England that is restructuring and those regional teams are changing and getting smaller. But we think there's an opportunity here to support safe, inclusive, coordinated expansion to education and placement capacity, to support that right way of deploying apprenticeships and new roles. We saw a great example of it in the Southwest in their session this morning, and how that was all being sort of held through communities of practice and groups coming together. We think there's a great model that could help to sort of bind all of this together, which would be schools of psychological professions in each region. So we have schools of pharmacy, we have schools for some other occupations. Schools of psychological professions could really be the next step on that includes the sort of psychological professions networks, but also builds in this sort of more quality and enablement function around making all of this growth happen in a safe and coordinated way. Watch this space on that. At system level, so ICB, we really need to get psychological professionals into the conversations about workforce planning, and this is happening in some areas of the country. It's happening less in others, so we want that to be more consistent, so that that voice that can help to explain and illuminate how we can make all of this work in this really complex territory, in this real sort of fast-paced growth. And at provider level, so within trusts and other organisations, we need, of course, everyone to be focused on good clinical governance as we deploy this whole range of new roles, etc., building the education and training placement capacity, and actually turning these numbers that are within the long-term workforce plan into posts. And that's really key. It's all very well having numbers written down, but this only makes a difference to people if we can convert them into real people in posts. One of the things that we think will be important in retaining great people in the system is more senior roles across our professions. We know that at the moment, senior roles aren't as widespread as they perhaps could be across some of our groups, psychological therapists, psychological practitioners. We want more of those senior roles, so we'll be sort of supporting and pushing on that as well. So I'm going to end there. I hope that's given you a flavour of what I think some of the key implications are in the plan. But it's, of course, really important to ask ourselves the question, well, so what from a public point of view? And so I've asked Jo, Sharon and Paul if they would reflect on this, and we sort of agreed together on a couple of questions that for them to think about in their answers. And one was, why is this important? You know, what is important about this plan? And two is, what do we need to consider if this is to actually make a difference for the public? So it's a great pleasure to hand over to Jo, who I think is going to give us some thoughts on this question, on these questions. First of all, over to you, Jo.
Thanks ever so much, Adrian, and thanks for such a good sort of overview of the plan. My stories from sort of what's happened to me in the last 12 months. I've had 2 operations for physical conditions, and what's interesting was how there was evidence of a more psychologically focused NHS at the time of both those interventions. So last December I had hand therapy, and I was fortunate in that I could have the hand therapy with local anaesthetic. So it meant I could talk to the surgeon while in theatre, and he asked me about so what am I doing now? And one of the things I do is I work as an expert by experience at the University of Manchester on the Doctorate of Clinical Psychology, working with trainees. He was delighted to hear this because he pointed out that a lot of his work involves working at Whittington Hospital as part of the burns unit. And he gets lots of young men coming in after road accidents, needing in effect to be patched up. And he says, well, I can do as much as I can do to help them recover physically, particularly facial injuries. But what I cannot do is address the inner pain and the inner burn. And that's where I need colleagues like clinical psychologists, where I can pass on to them and say, right, Jo, I've done as much as I can for you physically. I now need you to engage in a conversation, sort of with psychological professionals about how this leaves you mentally. I thought that was a really interesting conversation that I was bizarrely having while in theatre, while he was working on my hand. He was multitasking, clearly. Then in January, I'd been living for 4 years with prostate cancer, and in January I was told I needed to have the prostate removed because my PSA was increasing to a level where that would need to happen. The operation happened in May, but in March I had a pre-operation, well-being session with 6 other men who were also approaching the operation. And all sorts of what I'd call psychological factors were brought into that conversation. So how are you as men going to cope with the fact that you won't be able to produce sperm after this operation? How does that make you feel? For somebody of my age, that's perhaps not such of an issue, but for men in their 30s and 40s, that is far more an issue. And what practical steps can we take in that situation? That was such an informed and such an insightful conversation pre-op. 6 weeks after the operation at the end of June, I was told that my cancer is now undetectable, and the surgeon looked at my body, how my physical wounds were healing, but he asked the key question, but how do you feel in yourself, Joe? How do you feel in yourself? And this, I felt, was such an important part of that ongoing conversation. And I think that's where I saw brilliant evidence of a more psychologically focused NHS, that yes, it was brilliant having the robotic assisted, sort of keyhole surgery. And I'm all for AI if it does that. But I think also there is the more existential question of how does surgery make you feel post-op, and it's there that the psychological professionals come in and have those conversations with us, and the people working, as I think, like as the mechanics, can pass on that to the other folk who are talking about these more existential things. So that's where I'd want to park it at the minute. But yes, I felt I definitely found evidence of a more psychologically focused NHS, and hurrah for that. Thank you.
Fantastic. Thanks so much, Joe. And I mean, you've really highlighted for me in what you've described there. I mean, I'm delighted you received a service that you felt was more psychologically minded. But you've highlighted how that takes actually the whole multidisciplinary team, and it's not necessarily going to be a psychological professional or the specialist who is making that experience real. But psychological professionals can, I'm sure, influence it and help to make that a more psychologically informed experience.
And I think the point was, Adrian, that both men talked about not working in silos anymore and working across a whole team of professionals that are bringing in different skills into this to, in effect, sort of address the needs, the anxieties, the worries of their service user or their patient.
Brilliant. Well, thank you very much for those insights, and I'll hand over now to Sharon for your thoughts, please.
Thank you, Joe. It's just so interesting to hear how things have progressed, because I've been reflecting on the years that I spent as a volunteer complementary therapist, where I worked in hospitals and hospices, and I was supporting people mainly, but not exclusively, with cancer and HIV/AIDS diagnoses. And the hands-on therapies that I were doing very often released suppressed emotion. And so I can honestly say that a great deal of my time was spent in counselling people as much as anything else. So by taking that truly holistic approach, getting to know them, understand their situation, and often having the privilege, I'd say, of holding them whilst they sobbed their hearts out. So I'm not suggesting that professional huggers become sort of available on the NHS, although I am very aware that tree hugging is becoming much more popular. So I will push for that one at least. But my point is, I saw that the overwhelming majority of this work was carried out via the third sector, and it certainly wasn't uniform in either provision nor practice. And there was a continued reliance on charity funding and the goodwill of the therapists giving their time for free. So I acknowledge that many aspiring psychologists and psychology trainees are also unpaid whilst gaining experience, but I do believe that it is in the health arena that the expansion of the psychological professions within the NHS is going to make such an incredible difference to outcomes for patients, as Joe has just highlighted for us. I'd like, however, to point out that accessibility to psychological interventions and support is not always equitable. And my particular concern here is for carers who are often left to care alone and can feel left out of the picture. Now, this is often due to understandable confidentiality concerns, but carers may not have a clear perspective of what's going on for the person they care for, nor with regard for their own role in the caring situation. Now, it's known that statistically 3 in 5 of us will become carers at some time in our lives, and that obviously includes those of you who are working professionally within the NHS. But often service users are carers, and carers are or become service users. And according to Carers UK, 50% of carers become ill due to stress, which is something that happened to me on several occasions whilst caring. And carers often face major life transitions that need to be addressed alongside financial and work and career implications as well. So whilst the NHS has signed up to the Triangle of Care, which foregrounds carers, there isn't a great deal in the long-term workforce plan to suggest that carers are fully considered. And I note with my cynical hat on that people with learning difficulties, those with dementia, and the older population are also not highlighted in the policy. And I kind of wonder if this is something to do with sort of the government drive to get people back to work, which was certainly something that the IAP services were primarily focused on when set up. But regarding carers, I'd like you to bear in mind these figures. So the NHS health budget in 22-23 was £185 billion. But in the same year, the monetary value of unpaid caregivers amounted to 162 billion. So that's the equivalent of 45 million per day saved in NHS care. It's almost another complete NHS working in the shadows. My concern, therefore, is how to get more of these voices heard when they are perhaps unable or too busy to speak for themselves. I'm pleased to say that the PPN takes expert by experience consultation, collaboration, co-production seriously, which is why we are here today, and a larger group of us have been involved in producing and presenting the conference. In my other role as chair of the advisory group at Surrey University, I also know that having expert by experience advisory groups integrated in all professional training and services is one way of ensuring that present and future professionals are well versed in the issues that can arise and are informed on what works best for the people they're being trained to care for. And this is fairly well established in social work, nursing and clinical psychology, but does need to be the case for all other psychological professions and health providers. And crucially, it needs to be budgeted into the commissioning of training places to make it viable. So thank you.
Thanks, Sharon. I mean, wow, what a fantastic manifesto. And I really appreciate you bringing the needs of carers to the fore, because I think carers obviously hold a key actually to the success of the NHS for the future, because carers are sort of vital in supporting people out of hospital or out of different forms of professional care and treatment. So we don't give them sufficient sort of attention within our plans very often. Thank you for highlighting it. So finally, I'll hand to Paul now and hear what your thoughts are. NHS Long Term Workforce Plan, so what?
So what? Thank you, Joe and Sharon. So what? If it wasn't for the psychological professions, I wouldn't be here. I can hand on my heart say that. I've stood on a bridge wondering what time the next train was. If it hadn't been for you fantastic people, I would not be here. So that's what it is. I'd just like to thank Joe as well regarding the physical and the mental health. I'm very passionate of the parity of esteem, and yes, it would be great, wouldn't it, to have PWPs and CBT therapists and other psychological nurses and people at healthcare when you're diagnosed with a cancer or a long-term condition. That's utopia for me. That would be absolutely fantastic. But the area I'm just going to touch on is an area that I have a real passion for as well. And through work that I've managed to do with Talking Therapies, Adrian, and also the BABCP, is training. The fact is, I couldn't be a psychological professional. I'm not educated enough. I was a detective for 25 years. I spoke and worked at the highest level, but I haven't got a degree. Now that really spoke to me when I first started thinking about, well, there's a lot of people with a lot of absolute fantastic talent, that could be used within psychological professions. And I wonder how we're going to embrace this, how we're going to do it. Yes, we've got the apprenticeships now. Fantastic. I think we're looking at the bigger picture, but I think we need to look at it a little bit more. And I think we need to look at the diversity of the skills available. Yes, we need to have that clinical knowledge. We really do, because as the patient, I want to sit there knowing that I've got somebody who has got those skills and abilities to be able to help me. But more importantly, I want them to be able to engage with me, because it doesn't matter for me as the patient whether you're an A-star student. I want you to engage. I want you to have those smiley eyes. I want you to know what it's like to be me. Now, my thoughts on that are that if I am the person sitting on the other side, then maybe we should be looking at the diversity in as much that for everybody who is entering as a patient. So we've got to look at the diversity and match that to the dynamic of the patients that they're going to be seeing as best we can. But for me, it's really important to say that this isn't just my opinion. This really isn't just my opinion. If it's just my opinion, it's worthless. It's speaking to a lot of other people, a lot of other colleagues who are EBEs, but more importantly to people who reach out to you when you tell them that you have a mental health problem, because you're breaking that stigma, whether it be young people, whether it be old people, whether it be people in sports clubs or down the pub or walking down the street or walking your dog. Anybody you speak to wants help when they enter into that, and it's about making sure we've got the right fit for people. Now, the thing that I first thought when I started working with talking therapists, I couldn't understand why there was no career progression for a PWP. As a police officer, I stayed as a constable for the whole of my career, but I specialised. I was a detective. Now, we've got loads of people who don't want to progress through the senior management to CBT, high intensity therapists, to clinical psychologists. They want to stay as a PWP, but they've got so much to offer. And now we're looking at that career progression. It's fantastic. To me, a senior PWP should be a senior PWP, not a managing PWP. Someone with the experience, someone who can nurture. It also surprised me that although it was fully funded, people were leaving after they'd become PWPs, and that was just frightening. And it was like, well, yeah, the expectation is you stay for this long, but actually, when you do leave, we didn't actually do anything about it. We didn't say, oh, well, you need to pay us the training back. We'll use it and then we'll go into private practice. So having that career progression is a way forward. Another thing we talked about is part-time routes. People have different challenges in their life now, whether it's work or other things in their life that impact on them being able to work full-time. If we can get people to work full-time and we can get them to work remotely in certain circumstances, then I'm all for that as well. Which brings me on to the use of technology. We've got to embrace technology. As clinicians, we've got to embrace it. It's a tool that can assist us. We know, as a public servant, I know you get very, very stretched with your time. It's lovely if we can get the use of technology to work alongside ourselves to see more people. But it's a challenge. It really is. We just want help. And that, for me, is the one thing that encapsulates all the fantastic work that you do, is every time you see someone, understand they want help, and engage with them as an individual, as we should engage in the long-term plan as everybody, as individuals, as professionals, because everybody's story is different and everybody has got different strengths, whether it be from low intensity to high intensity to clinical psychologists. But thank you very much for everything you do.
Thank you, Paul. Fantastic. And you've really highlighted that if we're just counting numbers and not looking at the quality of what people are delivering, then we're missing the point. So thank you very much for just showing that very clearly to us. So thank you, Joe, Sharon and Paul, for your incredible insights and for, I think, keeping us all attending to, you know, what's the prize here, and why is this important? Sometimes, you know, I think we can get caught in our own little bits of the problems we're trying to solve to make some of this happen. And I think you've absolutely helped us keep an eye on the bigger picture. Okay, so we've just got a few minutes to now look at how you've been getting on with those questions on Menti. And so if you haven't yet logged into Menti, here's a chance to do so. We'll just give you a few moments to do that. You just type menti.com into your browser, and then there's the code that you need. And I'm sure we can just post that again into the Q&A so that people have it to hand. There it is. So if we go to the first of these questions, and, you know, forgive us, these are a bit sort of tongue-in-cheek, these questions, and I'm sure they don't give you all of the potential answers that you might have wanted to choose. So have you read the NHS Long Term Workforce Plan? So we've got quite a number of responses already. I'm delighted to see, my eyes aren't that good, but I think it's either 6 or 8 people have read all 151 pages. So that is very impressive, and I have to say that makes you the most diligent and sort of interested audience so far that I've brought this sort of this content to. Largest group of you, yes, some of it. Some of you have found it but not got to it yet, and some of you haven't got to it at all. So I do recommend that you have a look, and because I think this can be a tool for us to help drive change, and change that's important. Okay, I'm not seeing many more come in, so perhaps those who've wanted to log in have. Let's move to the next question. What do you think are the most important opportunities in the NHS Long Term Workforce Plan? And you're asked to put these in rank order. Sadly, at my end, the screen is so small I cannot read. I cannot read what is in what order. So I'm going to ask the team. Can anyone else see what are the top 3? Would anyone just like to come in and read those out? Oh, yeah, Sharon, you've got the best eyes. Thank you.
Yeah, so first it says to develop initiatives that support retention. The second one is to grow psychological professions training. The third, to support the growth of new roles in the psychological professions workforce. They are not quite exactly the same, but not far off it. And it then shrinks a fair bit to the fourth one, which is to grow the psychological professions by another 100%. And then the smallest one, the fifth, to develop digitally enabled psychological interventions.
Brilliant. Thank you for being my eyes. That's really helpful. Let's go to the final question. What can you do in your role to help enable these opportunities? And you could pick any and all of these if you wanted to. And again, these may not be all of the potential opportunities. And again, the writing is very, very small. Even if I take it to my largest screen, Sharon.
I don't know. I seem to have a bigger screen than you, obviously. So the blue 15 says start my career in the psychological professions. 28, I'm pleased to say, or boosted up to 29, is bring an expert by experience voice to the developments. Yes. 19, the red one, create new posts in my service. 26, the yellow one, expand senior posts in my service across the psychological professions. And 32, the green one, support the integrated care board workforce planning process.
Brilliant. Thank you very much. Well, I'm delighted to see so many are sort of interested in getting into that workforce planning process. I think that can make a real difference. But also, as you say, great to see the sort of commitment to expert by experience involvement and the other areas. Thank you so much for that. That's been really interesting and useful to see. So we now just have a few minutes for questions, and I think we've got about 6 minutes, so we'll probably be able to take 3 or 4 questions. And I'm going to introduce Jacelyn Stoneham, who's Programme Manager for the Psychological Professions team. And Jacelyn has been sort of watching the questions come in and has, I think, distilled those out into 2 or 3 key ones. Jacelyn, over to you.
Thanks, Adrian, and hi everyone, and thank you, Sharon, for your eyes for Adrian just momentarily before. I'm going to come to actually, Sharon, I'm going to come to you first, if that's okay, and just ask around your reflections on what you saw on the Menti, in particular the second question, where retention of the workforce was sort of came out on top, but not far equal with the other 3. So can I ask you to sort of give us your thoughts on what's important around the retention from your perspective?
Yeah, sure. Golly, so many things. I mean, as I pointed out when I was speaking, you know, many professionals in the NHS are carers or do have, you know, need to use services themselves. So it's that all-round insurance that their well-being is taken into consideration, I think, is really important. In training as well, you know, it starts there. It's not just when you're in the job or doing the job. I think it starts at the very beginning, that we provide this really enabling culture for everybody to enter into the training and to continue through in their careers. As I say, remembering that like 1 in 4 of us is going to have mental health problems, and, you know, 3 in 5 of us are going to be carers. So it's ensuring that those things are taken into account as well.
Thanks, Sharon. And I'm just going to expand on this a little bit further, which is related to about 3 or 4 of the questions that have come through in the Q&A. So thank you to those who posted this. There was a question around, how do we retain those who have just completed training? And even further from that, how do we retain the staff within the NHS to ensure that we are going to achieve the 100% increase in the workforce growth? And I wonder, Adrian, if I could come to you to start with.
Yeah, thank you very much for those questions, and it's just such a critical issue, and we're really all going to need to work together on it. I mean, for me, it's about creating careers rather than jobs, so that the sort of services that we deliver are places that people want to make a career. So it's having those right conditions that make it clear that this is a better option than independent practice or working outside of the NHS commissioned system. And that means things like, you know, opportunities for development, CPD, opportunities for progression into more senior roles. So all of those things need to be right. I think that culture and leadership needs to be right as well. The single most significant factor in people leaving their job is their relationship with their manager. And so, you know, I think we need to make sure that sort of culture of leadership and the professional leadership is right, that gives people support. And I did see in the questions as well, you know, people reflecting on, you know, should there be further requirement for people to commit to staying within posts where their training has been funded? And actually, I would agree with that. I think that is in fact already within the gift of employers for some of our roles to enact. You know, there need to be both sort of the right conditions that make people want to stay, but I think there's also a sort of a fair deal to be struck. I know it's true in many occupations that where training is paid for, then people are sort of expected to give back to the service for a period of time.
Thanks, Adrian. I'm just aware that we are coming to time, so I am going to ask quite a more generic question, which is linked to one that did come through around placing or having more psychological professions in physical health services. But I'm going to ask this a little bit more generically, if that's okay. We are aware that there are gaps, there is inconsistencies, and I just wonder if I could come to Jo and ask, from your perspective, why is it important that we would want to ensure that we've got psychological professions working in all services where they are needed for those both using the services, so patients, carers and their families?
Well, I mean, the key thing I think that's come out, I think, of COVID is the notion of, sort of psychological well-being is so moved up the political agenda. We do it because, as you say, that's what the public wants, and the link between physical immobility or disability and mental health are far more interconnected now. And again, I think that's been one, quote, good thing that's come out of the sort of the post-pandemic conversation. I mean, the other thing, I'm going off on a little bit of a sidebar here, but I have a family member who at the age of 40 has finished being a primary school teacher to retrain as a child psychotherapist. And I think that's wonderful. But again, having those opportunities through your own life story to suddenly think, this is where I'd really rather be, and this is where now I would want to address my skill set and my expertise and follow through a passion. And the notion that for all people working in the NHS, that theirs is a journey too, and they're bringing new experiences from the home into the workplace, and that those should be all part of their career development, if you like, and they can say, because I'm a carer at home, I now bring that expertise into the workplace and want to reposition myself in this particular place because this is where my passion is.
Thank you, Joe. That was really insightful and couldn't agree more. I am now just aware of the time, and I just want to first of all thank you, Sharon, Joe, Paul. I do apologise for not being able to come to you in this very quick fire time that we had remaining. But before we sort of move on, thank you to everyone and the questions. I know there's an awful lot we haven't answered. We will take those away. We will certainly look at them and ponder them and think about them and look at where we need to align this going forward as well. Can I come to Phil now to just start thinking about the ending of Psychological Professions Week?
Yes, hi everyone. I'm Phil Self. I'm the chair of the PPN in the Southwest. So obviously it's been a really exciting week with lots of things happening in lots of different places, and because there've been so many parallel events, obviously nobody's been able to be at everything. So I just wanted to share a few personal reflections from the events that I've been at, and what I think might be some of the themes that I've noticed over the last week. So the first thing is that I was reflecting back on the very first Psychological Professions Week that we had a few years ago, and I seem to remember we spent quite a long time explaining who we were as a professional family. It just struck me how far we've come from that, actually, and how we started off our week this week focusing on next steps in EDI. And after, I think it was Margot that made the comment that widening participation is often seen still as an extracurricular activity, it struck me as really important that that was front and centre, actually, in our narrative now. And other themes that I think came out was moving beyond representation in thinking about our diversity as within psychological professions, and how that involves some really difficult and uncomfortable conversations and being prepared to engage in that. So I think the Northeastern Yorkshire session on anti-racism and using caucusing within their developments of anti-racist practice really highlighted that. And then the Southeast session on Tuesday around psychological practice and psychological practitioners working with the LGBTQIA plus community also talked about bravery and courage. And so I think that's an important theme across the events this week. There's also been a theme around integration and how we integrate in new areas and with new services and new stakeholders within psychological professions. So the event in London on Wednesday, looking at psychological professions in physical health practice, focused a lot on integration in new services and how we collaborate in new spaces, but also how that can be challenging too, and how we're entering into difficult, challenging conversations there as well. We've also throughout the week heard from lots of new voices. So it was fantastic to hear from the APPs in the Northwest, from the CAPs yesterday, from several communities of practice around other groups as well, hearing from trainees too that are really new voices that are contributing within psychological professions, which is fantastic. As well as several people have mentioned, working with experts by experience and carers throughout the week as well. And then today we've come to growth and talked quite a lot about growth, both the growth that we've had and the growth that we need to have and going to have in the future. So I suppose that's left me reflecting on how I think we have got a much stronger collective voice now than we did 5 years ago. But I guess that raises the question of what are we going to do with it? What do we actually want to say with this? And also, perhaps we as a group should know better than everyone else that if we really want to influence psychological practice in healthcare, probably just speaking louder is not the thing that's going to really result in change. So my reflection is that I wonder whether we need to listen to and really try to think about how we can meet the needs of groups that we've not worked with so much before, both in our communities, but also in other areas of the NHS, and really understand the needs of our colleagues in those areas too. Are we always speaking the right language even when we're speaking with one collective voice? But having said all of that, I think it's been a fantastic week that has really made me think. It's fantastic to see that we're not only growing in numbers, but we're growing in influence, and I guess therefore in responsibility too. So my final reflection is, I think we need to be brave as we go forward. Let's be more brave and more courageous.
Fantastic. Thank you so much, Phil. And I know some people make it their ambition to visit every country in the world. I think it's been your ambition this week to get to every session in Psychological Professions Week. I'm not sure if you quite got into all of them, but I think you got to nearly all of them. So thank you very much for being our keynote listener, having been in all of those sessions during the week, and for those incredibly insightful reflections. Wow, what a week it's been. It's just been amazing, and a great opportunity to connect with so many colleagues across so many different areas of practice, with such sort of hope and positive intent. So I guess I just want to finish by saying some thank yous. It's a thank you to everybody who's spoken across the week, everybody who's been part of the team behind all of this. We actually haven't got a picture of everyone who's spoken and the whole of the team behind all of this, but this is a good many of them who met for the PPN Away Day nationally back in the summer. So thank you to everybody. Thank you to all of you, whatever role you've played in making this happen. You've all been absolutely brilliant, and I think the outputs are just amazing for the way that they will have an impact. Thank you to everybody who's attended any of the sessions, including today, and for your active participation. And finally, I want to say psychological professions aren't just for a week. They're obviously sort of really important roles that we want to sort of drive forward and make the most of for the public across the whole year. And my invitation to you is to use this week as a driving force, a sort of refresh and momentum to take this work forward together in dialogue, in collaboration over the coming year. That way we will continue to have a real impact. Thank you very much.